Oral tirzepatide versus injectable tirzepatide. What's actually the difference? Because right now the internet talks about GLP-1 medications like everybody suddenly needs to become a hormone scientist just to lose weight. And honestly, I think that's part of why so many people feel overwhelmed before they even start. You go online trying to learn about weight loss, and suddenly people are arguing about peptides, insulin resistance, microdosing, food noise, fasting windows, muscle preservation, inflammation, glucose spikes, and whether you should apparently be grounding barefoot in your backyard at sunrise. Everybody relax. Most people are just trying to feel healthier, have more energy, lose weight sustainably, and stop thinking about food every 14 seconds. That's the real conversation. Now, when it comes to tirzepatide specifically, one of the biggest questions people ask is, should I do oral or injectable? And honestly, there's not one perfect answer for everybody. Some people love the convenience of one injection per week. Other people hear the word needle and immediately start negotiating with the universe. Both reactions are completely normal. The reality is that both oral and injectable tirzepatide are designed to support things like appetite regulation, cravings, blood sugar control, and sustainable weight loss. The biggest difference is really the delivery method and how it fits into somebody's lifestyle. Injectable tirzepatide is typically taken once weekly. Oral tirzepatide is taken daily by mouth. And honestly, a lot of the decision comes down to practicality. Some people like the simplicity of a weekly routine. Other people feel far more comfortable with a daily oral option because it feels less intimidating and easier to integrate into everyday life. And comfort matters more than people realize. Because one of the biggest mistakes in healthcare is pretending everybody should approach treatment exactly the same way. That's not realistic. People have different comfort levels, schedules, routines, goals, budgets, and personalities. And honestly, that's okay. The internet loves turning health conversations into extremes. Either this medication changes your life overnight, or the world is collapsing because somebody took a GLP-1. There is absolutely no middle ground online anymore. But in real life, most people are not looking for perfection. They're looking for something sustainable, something realistic, something they can actually maintain long enough to finally feel better again. Because a lot of people struggling with weight loss are already exhausted. They're stressed, busy, underslept, emotionally drained, trying to manage work, kids, schedules, responsibilities, and modern life all at the same time. And now the internet expects them to become full-time metabolic researchers overnight. That's exhausting too. At AZHM, one of the biggest things we believe is this: healthcare should feel collaborative, not shame-based, not intimidating, not fake guru culture. Just honest conversations about what may realistically work best for your body, your lifestyle, and your long-term health. That's why we're proud to offer both oral and injectable tirzepatide options, because different people need different approaches, and we're proud to help patients across all 50 states have more practical, human, and sustainable conversations about modern weight loss and metabolic health. If you'd like to learn more about AZHM or explore your options, visit tryazhealth.com. And honestly, most people are not looking to become superheroes. They just want to feel good in their own body again. And that's a pretty reasonable goal.